For this lab, we're looking at the detached left pelvic limb on the calf specimen. So you've removed the skin just like you did on the right side with that medial incision and then remove all of that skin. And so we're going to take a look here at the lateral side first. So if you remember, you have your gluteal biceps muscle here. And the tensor fascia lata muscle was this kind of triangular shaped muscle here that's attached to the fascia lata. So that's this big fascial sheet here. It's the fascia lata. And it may be a little disorienting on the left limb because it's been detached from the body. You only have stumps of some of these, so you just have the distal portion here of tensor fascia lata. So that's pretty easy to cut off, so I want you to be very careful and try not to lose your tensor fascia lata muscle when you're doing this dissection. So if you take this and reflect it distally, you'll get to your quadriceps muscle group. So here we're on the lateral side, so this would be that very large vastus lateralis head of the quadriceps. I'm going to turn it just a little bit so that we're looking more from a cranial view. And you can see that this vastus lateralis actually kind of laps over top of the rectus femoris muscle, or rectus femoris head of the quadriceps here. So that's that lateral side of the bun, and you have your hot dog in the middle, but the bun is kind of covering up the hot dog in the calf here. So you have vastus lateralis, really big and thick. You have rectus femoris, which is also very large and thick. So much thicker than it was in the pony here. So rectus femoris is all of this right here. And then on the medial side, you have relatively this smaller vastus medialis head. Then you want to reflect your rectus femoris muscle distally, or at least just out of the way. And so here, inside the bun, the bottom of the bun, you can see vastus intermedius. So that's sitting here in the bottom, where the probe is. And hopefully we can maybe turn that so you can see inside there and get a little bit better view of that. So here we've got rectus femoris is the one I just moved out of the way. And then you can see vastus intermedius here at the bottom. And then you have vastus medialis, vastus intermedius, rectus femoris, and vastus lateralis. So those are all the parts of the quadriceps muscle. And after you view those, you can turn to the medial side. So we're going to turn it just slightly more to the medial side. I'm going to move this tensor fascia lata out of the way. And I'll reposition these muscles back to where they started. So again, maybe a little bit disorienting for you to just have the distal parts and not have them attached to anything, but just do the best you can. So here on the medial side, you'll see the nice flat gracilis muscle. And so it's already been transected away from the body when we removed that limb. So you can reflect that distally. So gracilis is there. And then you can kind of see it's tying in with that sartorius muscle. So this strap is the sartorius. You can reflect that distally as well. And here in the calf, we have that huge semimembranosus muscle. So all of this is all semimembranosus muscle in the calf. And it's difficult to distinguish from the adductor muscle. It was especially hard on that right attached limb because you just couldn't get in there to see it. But on the left limb, hopefully you'll be able to distinguish between those two muscles and find a differentiation. So semimembranosus muscle is the really large, thick one, and adductor, relatively small, kind of triangular shaped here next to it. So adductor muscle is here. And then you have pectineus, just cranial to that. So this is pectineus here. And then if we put our sartorius kind of back in place, you can see that it forms that femoral triangle region. So the femoral triangle in between your pectineus and your sartorius muscles. So femoral triangle is here, and then you have your femoral vessels there. So you have a femoral artery and a femoral vein. Here in the calf we don't have injection, but you can still see that there are the two vessels there. So you definitely have a vein and an artery. So those are the femoral vessels. We will not have those deep inguinal lymph nodes that we talked about. The calves don't have those. Then we can also hopefully see just a remnant of that iliopsoas muscle. So that's right here, the iliopsoas, just a little nub, a stump there. And that's attaching on the femur. So now we'll take a look at the stifle region, and we'll turn it to a cranial view for that. So here we're seeing the stifle region, right here, the knee. And so again, similar to the pony and to the other side of the calf, you're going to look for these 3 patellar ligaments attaching to the patella, which is right here. And the patellar ligaments are named regionally by where they're located. So you have on the medial side, you have a medial patellar ligament. On the lateral side, you have a lateral patellar ligament. And then in between, in the middle, you have a middle patellar ligament, right there. So all 3 of those attaching to the patella here, and then inserting on that tibial tuberosity. So the patellar ligaments are attached to the patella, which you then want to isolate as carefully as you can without losing your tensor fasciae lata muscle. And you want to cut all the way straight across those quadriceps. So just cut through the whole thing, and you're going to have a lot of fat and fascia, like I mentioned, for that knee joint to have to go through and work around. But you're going to go to the lateral side of the lateral patellar ligament and to the medial side of the medial patellar ligament and cut up and around your quadriceps muscle. So then you can free the patella and reflect it distally like that. So you'll have your patellar ligaments still attached, try not to cut those, and you'll still have your patella, and you just reflect everything distally so that you'll be able to see into this stifle joint here. We also want to point out the medial collateral ligament of the stifle joint. I'll put a probe under it and turn it slightly there. So that's the medial collateral ligament of the stifle joint. Then we'll turn a little bit to the lateral side, and we'll find the lateral collateral ligament of the stifle joint, so right there. So that's on the lateral side, so lateral collateral ligament. Then if you can get someone to help you, or if you can get the joint to bend, sometimes actually just setting it on the table and trying to bend it like that is helpful. But if you have help, it's even better. But if you can get it to bend, and I'll try and give you a cranial view here so you can see those ligaments. Here in the stifle joint, you'll have the cruciate ligaments. So this one that you can see running cranially, inserting cranially on the, oops, sorry, I'm upside down. That's my fault. This is the caudal cruciate ligament. So this is the femur. We're upside down here. So caudal cruciate ligament will go to the caudal aspect of the tibia. So it's named by where it inserts on the tibia. Caudal cruciate ligament, cranial cruciate ligament is coming out cranially here and inserting cranially on the tibia. So cranial cruciate ligament, caudal cruciate ligament inside that stifle joint. That should be it on that limb.